All right. Welcome, folks, to our first e-learning series back in 2025. For folks who've been following our e-learning series, this event was supposed to occur in December as the final event of our Celebrating Community-Based Research Excellence series. Had to postpone that event, but we're very glad we can still have Katrine and Katie here with us for the event today. We'll be talking about the DASH project, Decisions for Affordable Social Housing, community-based research project. That was a collaboration between Katrine and Katie with the Alliance to End Homelessness Ottawa. As we get started today, I'll just acknowledge that the CBR Canada Secretariat is located on the Haldimand Tract. This is the traditional territory of the Anishinaabe, Haudenosaunee, and Attawandaron or neutral peoples. The Haldimand Tract includes 6 miles on either side of the Grand River. This is unceded land that was promised to the Six Nations of the Grand River in the Haldimand Treaty of 1784. We give thanks for the privilege to work and to live on this land that we now call Waterloo, Ontario. And at CBR Canada, we're committed to continuing to build relationships with First Nations, Métis, and Inuit peoples throughout Turtle Island, as well as promoting research projects and approaches to research that actively work towards reconciliation. If anyone in the chat box would like to share the land they're coming from, whose traditional territories they're coming from, we would love to hear, see who we have in our room today from across Canada. And for anyone who's maybe joining our e-learning events or even joining a CBR Canada event for the first time, I'll just introduce ourselves briefly before I introduce the presentation and the presenters for today. So at CBR Canada, we're a membership-based organization with a mission of advancing community-based research excellence in Canada by strengthening partnerships, building capacity, mobilizing knowledge, and championing community-based research among individuals, communities, and institutions. We are a social enterprise. We're funded entirely by over 70 members who pay membership dues to us, as well as individual members. As part of our programs that we offer to our members, we host events like these e-learning events, these webinars, as well as our monthly community of practice event. You can find information on our upcoming events, as well as recordings of past events, infographics summarizing past events, all on our website. And we'll share some links for that at the end of the presentation today. Our agenda for today, I'll very briefly, very shortly be passing it over to our presenters, who will have about 30 minutes to share their presentation today. We'll have about 20 minutes after that for question and answer. So I encourage folks at any time during the presentation, if you have a question, if something comes up for you, please just type it in the chat box. And then when we get to the question and answer period, I will address any questions that have come in throughout the presentation first. So we won't be addressing those during the presentation as we go, but please enter them as they pop into your head. And that way, when we do get to the question and answer, we can start with those questions that have come in throughout the presentation. So without further ado, I'll pass it over to our presenters today, Katrine and Katie. You can take it away and we can adjust our screen share here.
Super. Thank you so much. Katie and I have never actually presented together, so this is a really nice opportunity to be here. And I think in addition to speaking about DASH itself and DASH's Decisions for Social and Affordable Housing, that's what it stands for, we wanted to focus on the importance of community-based research. So I don't have control of the buttons there. Okay, perfect. So the first thing I wanted to acknowledge is that the project itself that we're talking about today is being funded by Social Sciences and Humanities Research Council of Canada. And then we'll just get into presenting who we are a little bit. So my name is Katrine Sauvé-Schenk, and I'm an associate professor. I'm at the School of Rehabilitation Sciences at the University of Ottawa. And I'm also a member of CREX. And CREX stands for Center for Research on Educational and Community Services. And this is a center of research at the University of Ottawa. It's interdisciplinary, and really all the people who are members of CREX have a shared interest in working together with community partners.
And I'm Katie Burkholder Harris. I'm the executive director of the Alliance to End Homelessness in Ottawa. So we represent 75 agencies in the city who are working in various capacities to prevent and end homelessness. They're doing direct service delivery for the most part. And we really tend to be the collective sector advocacy voice, but increasingly we're doing more and more work in sort of coordination of the sector and coordination of services. And I should say both of us are on unceded Algonquin territory. And in this work in particular, um, Ottawa's home to, Algonquin Nation, but it's also home to a lot of people coming from different places in Canada. We're part of the urban Indigenous community, First Nations, Inuit, and Métis. We have the highest number of Inuit folks in Canada outside of Nunavut. And so our work also in partnership with the Ottawa Aboriginal Coalition is really essential to this work. And especially around homelessness, for folks who are familiar with Jesse Thistle, he really did a great job at helping to broaden the understanding of what homelessness is for Indigenous people. And one of the first pieces of that is disconnection from land. And as community partners and researchers on stolen land, we try and keep that front of mind as we think about the partnerships we develop. We're talking about housing and using land owned by the city in order to build more housing for Indigenous people. So there's a lot of complexity there in terms of what does land back actually mean in our context? What does homelessness look like in our context? So just wanted to provide a bit of that, but we're just grateful to work with the partners. And I think Ottawa has a pretty healthy collaborative ecosystem of researchers and community partners and leaders. So I think I'm supposed to be the person on the next. So I don't think this will be a huge surprise to most folks, but I'll give you kind of an Ontario-wide overview of housing and the housing crisis, specifically focused on homelessness. I can give maybe some Ottawa numbers, but probably more relevant to have a bit of a bigger picture. A report came out last January from the Association of Municipalities of Ontario, which is probably the best data we've got on homelessness numbers. And they had found that 81,000 people were homeless. Of that, a major increase in people who were stuck in homelessness or chronic homelessness. So we're at almost 50%. It used to be much lower, closer to 15, 20. And it's just really exploded in the last number of years because I think, as we all know, the housing market is just not affordable for the average person, let alone somebody who's has a lower income or is on social assistance of any kind. And what I think is most striking is projections are looking at the pace that we are increasing homelessness in our communities. By 2035, if there's any kind of recession, we'll hit 300,000 people in our province experiencing homelessness. I think that we have some forces south of the border that may speed that process up. And so, really tackling the housing crisis, in my mind, is one of the most critical pieces to being able to both sustain what is going to be a set of economic shockwaves over the coming decade. And also, if you talk about any other social issue and economic issue, you can often get back to housing. If somebody's not safely, stably housed in an affordable way, they can't save up for anything else. It's much more difficult, obviously, to participate in the workforce, to go to school, to thrive, to have a family. Healthcare is worse without housing. We know all these different components. And I like efficiency. And so that's why I'm in the housing and homelessness world. Because if we have to tackle one big challenging problem, homelessness and housing is the one that has all these ripple effects to all these other places. So Ontario, what I think is really, really important that came from that report is that we have increased since 2016 by 34% or 32%. Sorry, 34%. We've put that much more money into emergency shelter beds. And we've seen almost a like for like increase in actual homelessness. So we invested 34% in shelter beds. We invested 34% into homelessness, and we saw almost an equivalent increase in homelessness. So I like to frame it as we're funding the creation of more homelessness. We are not funding the right things, and that's very much reflected in the data. So it also means that at this stage, and for folks who live in Ontario specifically, there's encampments in pretty much every town and city and in rural areas as well. And actually, there's data showing that we have higher rates of homelessness per capita in rural municipalities. And so I think that's something that's quite striking for a lot of political leaders across the province. And another kind of key thing that I think is important is that every single municipality in Ontario is now using some kind of fund for people called a rent subsidy or a rent supplement that basically just supplements their rent. We have created a basic income for basically most people who are low income and can't afford their housing. We don't like to say that, but that's essentially what that functions as. So on the bigger national stage, we all know the National Housing Strategy launched in 2016. The report from the Attorney General a couple years ago showed that about 3% of that money had actually gone to tackle homelessness and specifically people in the lowest income quintile. And we just have not seen, we have seen builds, that's been good. We have seen more construction, that's been good, but it's typically been supplementing private sector initiatives where the standards of affordability are absolutely not there. And the requirements have often looked like, well, you have to have an X percentage of affordable units in your building for 10 years, which is insane. That government has now been in power for 10 years. And I think that's something to really keep in mind. At the Alliance, we advocate so strongly for nonprofit or social housing. It is the only kind of housing that can meet human rights based housing need. And it's also the only one that can guarantee affordability in perpetuity. If it's subject to the private market to needing a return on investment, we're just never going to put people first. So that's sort of where we are in terms of the actual physical construction. I will say the message has been received, and I do think provinces and cities and the feds really do understand that we need to dramatically increase our social housing stock. Right now, across Canada, it's about 3.5% of our total housing stock. To get to even sort of a healthy level, we would need to increase to double it to get to 7%. So as you can see, wait lists for social housing. I don't know what it might be like in your direct community, but for us, it's like 12 to 15 years, even for high priority folks like people fleeing domestic violence of some kind. It's still months and months and months or years. So that is a huge challenge that we have. And the DASH program is really, really, I think, a really exciting opportunity because it's starting to build a bigger picture of what kind of housing do we need? Who needs the housing? How many units? All those different sorts of critical questions rather than just a blanket build lots of housing. So, and I was speaking to some of this. One thing that's interesting with the social housing application, there's not a ton of demographic data. You would know maybe the number of bedrooms that you would need in that housing unit, but you don't know a ton more. Even geographic areas, it's not super specific. And we don't have a comprehensive picture of how many people in a city or community at what income levels for the number of bedrooms are actually needed. And then on the other side of the spectrum, related to homelessness, the housing wait list and the homelessness wait list don't talk to each other. And there's other kind of versions where housing is assessed, like with many, many healthcare assessment tools that are used for people to access resources at community health centers, things like that. We're not necessarily asking about housing, or is it, if we are, it's not touching any of these other systems. So there's a really messy data picture in terms of both what needs are, but for our response, we're not actually targeting related to what is needed. And I think that's the opportunity that exists with Dash. So yeah, and we're not comparing apples to apples. I think one of the biggest gaps that folks are probably attuned to is the definition of affordable housing. The feds have a different one, then the province has a different one, then the cities have a different one. And in the city of Ottawa, we have, I think, 4. So that is very unhelpful, though there is change towards that. But it makes it virtually impossible to actually measure what is affordable, what's getting built across that spectrum. And very few of them are actually based on income. Most of them are based on market conditions. So the federal one is the definition I think is most relevant, and it's the idea that you only pay 30% of your before tax income on shelter or housing. And the other ones tend to be market based of 80% of the average market rent, and the city can supplement a little bit of that, but you have to pay 30% of the 80%. A, it's math. I don't love math. And B, it's based on market conditions, which, as we already know, is not affordable in our country. The average market rent in Canada, I think, is 2,200. I did the math yesterday. And it's just, as we know, not within reach for the majority of people. 40% of Canadians cannot afford more than $1,700 a month in shelter costs, whether that be mortgage or rent. And yet our average market rent is about 2,200, 2,100 for a one bedroom. So the math doesn't math. And we also don't have a clear picture of, within that giant group of people who can only pay $1,700, well, how many of those are families and have multiple members living in the house? How many of those are single people who only need a one or two bedroom? And we just don't have that picture. So I'm going to turn it over to Katrine.
Okay. So the goal that we have set for ourselves is really to improve access to the system level data that might be in existence. Everything that has to do with housing, with homelessness, and trying to put it together in a meaningful way so that we can support decision making. And what we mean by decision making is, can we know, as Katie has said, what kind of housing stock do we need to meet the needs of communities? But also, can this kind of information help us with developing different policies or changing policies that exist? And also, could we track progress if we had access to some system level data? We'll go to the
Oh,
next.
I should change it. Sorry.
Yes, just so you all know, Katie has the power of screen change, not me. So.
Just tap me with turn page, please, and I will do that.
So, an important step in understanding our project is really how we got to it as an idea and how old this idea is, which is actually quite young, because discussions started probably in 2021 when a few researchers we got together. So it started out in academia, I guess you could say, where somebody from social sciences, so that was John Sylvestre, who a lot of people might know from the research in housing, Danielle Amiot from engineering, and Lisanne Lessard, who does data management at Telfer at the university. And we were talking about this challenge with system level data. And we started to talk to community organizations that had to do with housing. And people started to build on the idea and tell us, they were telling us, this is a priority. This is an important direction. Maybe you should, start something off. So of all the organizations in housing ecosystem that we spoke to, the Alliance to End Homelessness became one of the big supporters of the idea. And so what we did is we decided, well, let's create a formal partnership and work together on this. And so that was in 2022, we developed the partnership. So turn page.
And can I just add to that? I'm always skeptical when researchers want to approach us. And the reason being, it often feels like there's a reinvention of the wheel. And what I was so excited about in talking to Katrine, I feel like I grilled you the first couple of meetings we had. I was like, well, have you looked at this research? Have you looked at this research? A, you'd done your background, but B, you chatted with so many community partners by the time we were chatting, and you had a really strong view of the landscape and the relationships and the networks. And I think that just gave me a lot of confidence in that, okay, we're not making something new. We're meeting a need here with this research. It's not just doing research for the sake of research.
Thank you for that. So we did partner up for real, and we have signed agreements on how to go about this. And so what we consider to be the research team is really the interdisciplinary researchers from the University of Ottawa, along with the Alliance to End Homelessness of Ottawa. So we are both owners of all of the research, and we make decisions together. So all of the questions that we'll ask, the way we'll go forward, how the research steps will evolve, if we need to make changes, all of that is a shared decision. And the intellectual leadership and ownership is shared. I think that's the most important part of it all. It's not that one of us will leave with the data or with the innovation. It's really shared. All of those housing groups and community groups that we had talked to when the idea was evolving have now been grouped together, and they now serve as the advisory group to guide us. And the other important part here of who's part of the research team in terms of guidance is the expert steering team from the Alliance. And these are staff members of the Alliance, and they're people with lived experience who can guide us, provide us with insight, and really help us make sure that we stay grounded to the real realities of the world and the needs of our community.
And we'll get to more of that piece a bit later, but I think what we're doing at the Alliance is really ensuring we have a staff team of people who they provide input on research, on policy, on program design, and their job is not to tell their story. And I think too often, I mean, it's not just tokenizing, but too often there is this dynamic of trauma farming and not actually also having a skills matrix for engaging people in this kind of work, not actually asking like, oh, what are the skills that you would bring to this role? And we have a staff team of people with a diversity of skills, but I think some of them some people are more research oriented, consultation work, public speaking, being on different kind of working groups. And that's been really important. I was actually working with a researcher in another project, and they were asking about having people with lived experience on their team. And we were like, well, what are you looking for in terms of areas of expertise? And the standard was like that they show up. And I was like, okay, and I think that's where we've been in a certain level in terms of lived experience engagement for a long time, where that broader expectation is not there. And also that recognition that people have homelessness as a piece of experience that they have had, and they have all these other skills. And some people don't necessarily have the skills to do something in a research environment as anybody else. And so I think that's something that we've tried to be really thoughtful about in bringing people into the project where, yeah, their skill set makes a ton of sense in this particular project. They're able to do broader consultation, all that kind of work. So.
So what exactly is the idea of DASH? So we said to increase access to system level data, and how would we get there? So here's an example. Of course, this is more of a cartoon way of seeing it. So most of the data that has to do with housing and housing needs is in three big data sets, we could say, in most communities. So this is sort of a caricature. So if somebody wants to have social housing, they usually apply through a chronological wait list. So that's one set of data. Now, people going through the shelter systems, their names and information and what kind of needs they may have in terms of housing will go into another data set. And then if we look at housing and housing stock, that's usually not even a data set in some communities. It's just parceled around. People could say, well, how many units does that organization have and that organization have? But we could lump it together into one data set if we were going to do that. So the idea of DASH is, could we access data from all of these data sets, pool them together or aggregate them, combine them, so that we could then offer a dashboard, an open data dashboard that would show us exactly in what communities, what kind of housing do they have, what are the people who have needs, and what kinds of needs do they have? And can we see some specifics about these people? So Katie, you were talking about apartments. Do we need a 4-bedroom, a 1-bedroom? Where do we need this apartment? But also things like, does it need to be accessible? Is it a person who has a guide dog and needs access to outdoor space? Who are the people on the wait list? And then can we say something about these needs? And does it even match with the current housing stock that exists in that community? Now, I also put a little box there that says other data sources, because there's some of the data about people and their housing needs that's not even contained in the two main, the chronological wait list or the homelessness data sets. So can we put it together in real time and then on an open dashboard show it to not just housing organizations, but really to all of the world? Well, not the world maybe, but whoever is interested in it. Can people then, if it's open data, then people can participate in decision making at all kinds of levels. So that's part of the big interest, is to be able to share the decision making, make people accountable, and then have a clear image of what our needs are. Just one more note before we go to the next slide is the fact that some people who are on a chronological social housing wait lists are often simultaneously on a list, the shelter data, right? So people waiting for their social housing may go between different places that they're living. They may have stable housing, unstable housing at different times. So it's important that when we have a dashboard that counts people and their needs, that we make sure we find them across the lists and not count them 5 times, right? That we really capture who are these individuals.
Mhm. It's such an annoying thing. And I think one of the silly things is that you have to apply for the social housing waitlist application if you want to qualify for a rent subsidy. So regardless of whether or not you actually want a rent geared to income unit, you have to apply for it to even begin to qualify for just a rent subsidy to live in the private market. So it's yeah, data for the sake of data without purpose.
Mm-hmm. So just some researchy stuff. I mean, in terms of our project, what have we been up to and what are we doing? So I think that one of the big first steps that we're still working on, and this has become a bigger part of the understanding of the potential for Dash, is just talking to people in different communities across Canada about the types of data that they collect, how do they use it, what are the practices, what are the processes, and also people's uh, ideas about Dash. So, we're talking across provinces. So in Alberta, what do they think of a system such as Dash? What do they anticipate as being problems with such a vision? Or what do they think might help the vision along? So that's been one of the big steps. And then the next steps the steps 2 and 3 have been really about figuring out in a technological sense, as a data solution, what are the requirements of something like Dash, and then building a prototype and testing it out. So far we do have a prototype, but it's been used with synthetic data, not with real person data. And we really based it on the situation of one municipality. Our vision is national, but you have to start somewhere. So we've been starting more on a small local level. I put some arrows there in a circle just to say that every time we learn something from somebody, it's important that we go around again and revisit our ideas. And also, every time we talk to our advisory group, other community members, we learn something, we revisit our ideas in terms of the research. Can move on to the next one. So far, when we've talked to people about our ideas, we've had a lot of positive feedback. You can see these are some of the quotes from the interviews that we've had. People are thinking that this would be great if we could just pool all the data, have a local picture of a situation, a more provincial or territorial picture, a more national picture, because importantly, we don't even have a national picture of needs. So we're really working in the dark right now. So people are quite positive about that. You'll notice in the purple little blurb image icon in the corner, it's thank you for highlighting it. People are saying, I'm hopeful about it, and also I think a little nervous. I think it's a super ambitious project. And of course, it is ambitious. There are a lot in the next slide. We'll look at just a lot of challenges that are coming up, some technological ones, some organizational ones, to just even developing such a data solution. One of the big challenges is that in all of the people we talk to, the different organizations all
Oops,
have, oh,
sorry.
that's okay. They have different priorities, people have different needs, and this is even within municipalities, we're finding differences in what people think is important in terms of a data solution. And then on the bigger and bigger levels, we see that there are big disparities, big differences between provinces. And we haven't talked to the territories yet, but between provinces, we see some big differences. The other thing is, again, the integrating the data. So we know that in majority of communities that we've found so far, the social housing, affordable housing, which also, as Katie, you said, rent subsidy lists, don't talk to the other types of data sets, right? And everybody seems to have a different setup, a different program, a different platform for their data sets. So trying to take data from these and then putting them together, pulling them together is a huge undertaking.
Mhm.
And the other big challenge is data quality that's being collected.
Mhm. And I think on that too, like for a long time in my brain, I was like, we're going to create the master database and everybody's going to be part of this master database. And I think you just hit a point, especially with community partners, where they're like, I have like 8 data programs I need to respond to because of different funding streams from the province alone, which is absurd.
Mhm.
But it's not that we can make, because all these different funding streams have different asks and all these things, but we need the data sets to talk to each other. And that's what Dash is actually able to do, is to get them to be able to talk to each other and paint a picture that currently we just can't do because it's so different across different data sets. And they're all going to different departments in terms of reporting. And it's just really not giving us that big picture. It gets us all quite stuck in the weeds.
Mhm. So there are some of the challenges. We can go to the next one. So the big question, I think, especially for this audience, is why did we choose to use a community-based approach, seeing as it's the big topic of CBR? Um, so I think that everybody who's involved in this project clearly has the idea that if we have a big, complex, social, real-world problem to solve, the best solutions will come when we integrate all the experience, all the knowledge, all the different viewpoints from everybody, right? That's the best way to go about it. In terms of this particular partnership, there's academia with it. So we call it the Campus Community Partnership, which is just mixing the two together of academia with community organizations. And I'm not sure who's listening to this today, and there's maybe some people from the universities, I'm assuming. Um, what are the big challenges, or where are the tensions? I guess that's the better word than challenge. When you choose to do community-based research, there's some things that you really need to think about before you embark on that adventure. The first one, Katie, you spoke about it, was making sure that we're not engaging with community organizations and looking at the tokenism. So not having people participate because we need to check a box. Making time for those to engage with the community means making time to talk, to really discuss ideas, not coming in with an idea that's pre-cooked and then just saying, can you just check that off, say yes, and then we'll go forward. So not doing that does take time, but of course the benefits are really outweigh the the time it'll take. But funding grants and things like that have specific funding timelines that are hard to keep, perhaps. So being mindful of that. The other thing that is a tension, so as researchers, we have one perspective of a situation, and it will obviously differ from those of the people who are living the situation. Or if you're a frontline worker in a shelter, you'll have a very different viewpoint than me coming from my office. So it's important to juggle all of these things and realize that it is important to have disagreements, because that's where we'll have the best innovation, the best learning together. And also, as academia, the universities don't have the same measures of success as communities do. So sometimes that can be a challenge, because you'll have nothing to write in your CV for maybe 12 months, because what you've been focusing on is the relationships that you're building, which in my mind are more important sometimes than having that next paper. But that's a personal opinion of mine.
Oh, is it my turn?
Yes, it is.
Um, I'll just actually say on that, my parents-in-law are trying to spark a different way. This sounds so random, but at University of Saskatchewan, my father-in-law used to be a prof there, and they really in their retirement are curious about how to supercharge community-based research when the motivations within academia are so different. Journal publishing, real-world impact, unfortunately, is not necessarily the driving thing. And even when government contracts or things that are practical application of your research in the real world might even bring in more funding money, it's still not necessarily viewed with the same value. And so they've really been trying to figure out how can we facilitate researchers to be able to do community work, community-based research, knowing that there's bias, there's narratives there, there's status issues there, and then that just generally speaking, it just takes longer. It takes longer
Mhm.
to have that trust. I think Katrine coming with CREX was really important because CREX has a reputation. They've been working in the sector with community partners for years, and people trust them and they know the researchers. So knowing that there's other researchers coming into that space, there's automatically a foundation of trust that then just can continue to be built. But it goes faster now, but it used to take a lot longer, and it still takes a long time compared to funding timelines. So there's a
Mhm.
lot of work, I think, in carving out that space in universities, but then also with funders in order to, yeah, be able to do this work most effectively with community.
Mhm.
So for organizations, I mean, the biggest one I think is honestly lack of capacity. Like we have fires every day when I'm fortunately working more at the system level, at the advocacy level. So I'm not dealing with the fact that our kitchen flooded yesterday and I have to figure out how to, get all of our clients lunch. And that sort of stuff is literally what's happening on a daily basis. And for our members in particular, we're talking emergency shelters, emergency housing providers, supportive housing providers, day programs, but people who are supporting and responding to folks with the most complex needs, the people that hospitals reject, the people that more well-resourced institutions continue to reject, who have multiple complex things that they're navigating, ton of trauma. And so trying to get the attention of those workers, of those folks, of those executive directors is incredibly difficult. If you get the trust, that's great, but then the capacity is a whole other piece. So that's why it's useful to engage with a collaborative like the Alliance, because we are able to kind of sit at that bigger picture level while still having the expertise of our membership to feed into this, but not necessarily with the same level of time commitment for all of them. But that truly is that. And if you're asking people in the community to give time, then they need to be resourced. And I think that's the piece that often there's not necessarily resourcing in a funding application for the community organization that is giving up their valuable time. So that's a big piece in terms of capacity. And I think that really does feed directly into Indigenous leadership in this work. There is this constant tension with Indigenous partners around we should be brought in at the ground. If you're going to design something, design it with us, absolutely, and data ownership within that context. Um, and also the Indigenous community in general, certainly in Ottawa, their level of capacity, they are putting out fires in a way that I think the rest of the sector doesn't even understand. Just the level of not enough resources in their sector in general, much, much less resourcing, and just folks with really deep needs. And the additional dynamic of Indigenous communities are smaller, and a lot of people are not just providing services. They're providing services to cousins and aunties and family members. And when there is death and when there is trauma, it is affecting the workers. In fact, we have an organization locally where they're a housing worker trying to find housing and they are homeless. Like the depth and the discrepancy in terms of wealth and access and conditions that they're working under are completely different. And so it is essential to have Indigenous leadership, and also the capacity is completely different. And so we're constantly in that tension. And to be honest, we have good relationships with Indigenous partners. We work very closely with the Ottawa Aboriginal Coalition, which is very similar to us structurally, in that they have members who are the other Indigenous partners. And they also have a research team, which is great. So we work closely with them. And the ask is always bring us in at the beginning. But I've increasingly been finding like they're certainly responsive on some things, they're less responsive on other things. And I've just started to be like, you know what? It's tokenism if I'm chasing them for a project that they are clearly telling me is not a priority for them. So if I'm like, no, you need to be part of this project because we need, like, that's actually tokenism, even though it comes from a place of, I want people to be engaged, I want to co-design. So I've actually, as an organization, we've started to feel a little more comfortable with, we have trusted relationships. We don't need to have every single project make sure that we have an Indigenous leader at the table if they are telling us this is not a priority for us. Please don't take up our time. It is valuable time. So that's sort of a growing that we've done. And I think on this project in particular, we've had a similar experience. Like the invitation was open. Unfortunately, the person that we were first engaging with actually passed away with the OAC. And so there was then a disconnect in terms of carrying that information back to the broader group. And that's just grief on a staff team and in a community that also informs this. And that's what I mean by it's just a bit of it's a different world in terms of engaging with community because that stuff I think happens a bit more frequently. And so we've sought to have that co-design and that co-leadership piece. And it just hasn't, people have not had capacity and they've told us they don't have capacity. That being said, the next iteration of the project, we are proposing to do something that is beneficial for community partners in a different way. And so we're setting up a meeting with the Ottawa Aboriginal Coalition this week because there is an appetite for the next phase of this research. And I think that's, again, speaks to that notion of priority. And like we have limited time as service providers, and we will put our energy where it is going to be most helpful to the critical work that we do. So, and I spoke to this a little bit before, but meaningful engagement with people with lived experience. And again, I think that a lot of what we try to show a different way in the work at the Alliance is really rejecting trauma farming. All of our staff with lived expertise, their job is not to get up in front of a room and talk about their trauma. And actually, we actively do training and talk about not doing that, and that their role is they are there as professionals, like every other seat at the table, and we recognize power differences. And also, they are a voice with everyone else who has expertise to inform policy, research, discussion, what's actually happening. I'm the co-chair of the main governance structure for housing and homelessness in Ottawa. I'm co-chair with the City of Ottawa Housing Director. And what's really interesting, we had our prep meeting today, is that the city is like, here are the things that we've done and that are happening related to winter warming and making sure that we have enough beds and places for people to go when the temperatures get too cold. And that's great. And also, folks who are on the ground, service providers, yes. And also, people with lived experience are like, that's not what's happening. I know that this is happening, but there's a whole group of people that we're in contact with and connected to who are not getting access to services. What do we do about that? And so, to me, the critical importance of having people at the table with lived experience cannot be understated. And like, think about big tech. You don't design a product without user design. If somebody steps into using a product and it doesn't work for them, then you have to change the model. We have not designed a system where users of that system have informed it. And there's so many parts of our system that don't work. And that's why I think when it comes to research and the questions that are safe and that are healthy and what's useful to research when you are somebody who's had to navigate the homelessness system, that must be informed by people with lived experience first. So that's also been, I think, a really rich part of this work. Do you want to start, Katrine, on this part?
Sure. I see Amanda's face appeared on this, so that means we have to talk faster.
Mm-hmm.
What helps? So Katie said a lot of the things that help to have a good, successful campus community partnership. Make sure it's beneficial for all of those people who are involved, not just on the one side. Make sure that there's a common goal, that you're sharing the same values, that you're taking the time to build trust and respect with all the members of the group. It's really helpful when your partnership is not just about the project itself, but because of a bigger vision, so it transcends the project. Communication expectations that are clear, respecting the capacity of all. Katie, you talked about that. And just appreciating, yeah, I said that before. Conflict is good for learning and innovation. I said it started off, but I said it all. But so next steps for us.
Can I just say, okay,
Yeah.
no, we'll do next steps and then I'll finish with a piece at the end. Um, so this is what's interesting is as we went along, and I'm kind of unhelpful in that I kept asking, so wait, Dash is about the aggregate numbers for units. And the more that I was talking to our members and the more we started to talk about designing a better system, and that's part of the work we're involved in anyways, the more it became about individual need matching units. So not just the need for, I need a 2 bedroom at this income level in this geographic location. It became, I'm somebody who has, accessibility needs, or I need to live in a supportive housing unit because that's where I'm at and I need health supports 24/7. And then somebody else who's like, I need to live in a private market unit, but I need a rent subsidy to make that work and maybe some light touch supports, like a worker coming to see me once a week. So all of a sudden, it opened us up to, holy cow, the needs assessment of individuals is actually just as relevant to this work and Dash and accessing that data as the capital supply. And so now we're doing a thing that I'm pretty sure the research team looked at me like I had 4 heads when I first suggested it, but I think I've convinced them that it's doable. And community partners are like, oh my gosh, if we could do this, it would be very valuable. Um, we are basically stripping down the data indicators to like a base level and building back up from the grassroots. So what that means is that we're going to get somebody who's going to map all of the indicators at the city level for every relevant funding stream, indicators and definitions that people are asked to report on, all the data points for the various funding streams provincially and federally. It does seem like a big project, but essentially it's looking at a whole bunch of intake forms, figuring out what is actually the same set of questions. And then the big complicated piece is going to be around definitions, knowing that youth equals 18 and under in some contexts, youth equals 25 and under in others, and actually getting really, really clear on the definitions, but we're doing that at a community level. And so in Ottawa, what does our community actually say it means for this? And sometimes I'm like, federalize everything. Everything should just be national and consistent. But the value of doing it then is that the data is trusted. And when data is trusted, it means it's trauma informed. And we're not just asking a bajillion questions for the sake of asking a bajillion questions. That is another form of trauma farming. And we're actually asking data that is hopefully efficient in that the person who's standing trying to fill out a form and they've got 40 people in line can actually do it in the time. And when you make it meaningful, the person who's filling out the form for an intake is going to actually do it properly because they understand the purpose of the data that they're collecting. And it's also painting a clear picture of here's what your data does. When you fill out this information, it helps us to do this big thing that's really important to building out our 10-year plan for housing capital supply, which sounds disconnected, but is absolutely tied. So this project brings those pieces together in a really, really meaningful way. Do I go to the next slide or is that everything?
Yeah. I'm seeing Amanda starting to worry about the time. Yeah.
Okay.
Final thoughts. The final thought is, well, you got it. The final
Actually, I have a final thought.
Oh
no. My final thought is that I wish that research and evidence informed public policy. If it did, we would have NDP governments across the board. It does not. It does not. Well, if we were focusing first on human well-being, that's who would be in power. They are not. And I think the piece where the magic happens in my mind is that research can happen, rich, important research can happen, and advocates and lobbyists and people who do government relations in this world can social services and support for people, they can make it work. They can get it in front of policymakers. They can influence, they can push. We're not super useful if we don't have any research. However, we're very good at being salespeople. That's my job. And so the research enables that and gives it credibility, but research on its own without that mobilization and advocacy also doesn't create policy. And too often policy is created by like an MP who had a brother who had a particular experience. Boom, policy. Also that happened within 24 hours. Like that is the level where politics and policy work together or don't work together. And that's what's driving our policy creation. So if we can be the people in the middle who are like, yeah, we heard about the brother story, and also you could make that better by that really makes the difference in terms of really seeing evidence-informed policy happen. So that's my final thought. And now we'll go to questions. Sorry.
Let's all sit together and talk and collaborate.
Thank you both so much. I mean, everything you were speaking about at the end there, those the challenges in doing community-based research, what we need to authentically collaborate between universities and communities, and Katie, your final thought there too, just about research without the mobilization piece doesn't create policies. Those are all such really strong and interesting points I think you were able to come across. So thank you. Um, we have less than 10 minutes for questions. I see there's a couple that have come in the chat. A couple might be kind of quick to answer, so maybe I'll start with some of those. We had a question asking if Dash interfaces or connects with HIFIS4.
Yeah, so HIFIS would be part of that box that I was talking about in terms of the homelessness and shelter databases. So HIFIS would be probably the most popular of the databases, yeah, that has that data.
Okay, thank you. Another one that may potentially be a quick part one and maybe a lengthier part two. Part one of this question was, is the work currently grant funded? Which I think you touched on at the beginning. Part two to this question is, have there been discussions about where the data repository might eventually be able to live and be maintained long term?
Do you want me to take that one, Katie?
You can. I
Yeah.
have thoughts too. I
Yeah.
have thoughts and no money.
I think that was that is always a question that is left currently unanswered. I think we need to move forward with looking at all the options because should it be with the federal government? Should it be with a government entity? Should it be with a nonprofit entity? How is it going to live? What's the sustainability plan? That's still out in terms of our questions.
And ultimately, like the Alliance wants to be a system planner. Ontario's a bit weird, but system planner and other communities tend to be an external community-based agency that focuses at the system level. So that would be one opportunity, but structurally, our housing registry is operated differently. Like there would be a lot of governance pieces, but I suspect every community would be asking those questions. So for sure.
Mm-hmm.
I'm sure there's
Calgary. Oh, sorry.
I'm sure there's trade-offs to both. There's
Yeah.
perhaps better funding and support if it's government, if it's situated within that, but situated within nonprofits, it's just more control and more trust from the community. So
Yeah. Yeah,
Right. Yeah.
absolutely.
yeah.
hmm Yes.
So this was just a comment that came in from the University of Calgary. Very interested to see how the School of Architecture, Planning, and Landscape can get involved. So someone's put their contact information in the chat there. Opportunity to potentially collaborate with the National Quality in Canada's Built Environment Project. So I'll leave
Cool.
that with the two of you if there's any connection you want to make there.
Nushin, do you know Nick Falvo? Probably.
Yeah, I think so.
Okay, he's our main U of C contact, and he used to be in Ottawa actually, but we maybe have him coming to Ottawa for a thing in the next number of months. So, anyways, I'll like mentally, yeah. So feel free to.
And please check the Quality in the Built Environment project because it's a national-wide project and we're involved with around 14 universities all around Canada. And if you go to the website, you'll see that some of the sites, we have different themes, like University of Calgary, you have healthy cities, we have social housing, and we're already collaborating, we're hoping to collaborate with City of Calgary and Edmonton on social housing and on this topic. And so I think there's a lot of connection on finding the funding for moving forward. So I'll look forward to connecting.
Okay, I'm so excited to connect with you. Please send me an email because my inbox is swamped and I need a person to email me. But are you at all playing in the space of trauma-informed architecture?
Yes, we also have some areas of research in that part. Like there are some people who are interested. We just had a person who left, but Sarah and Cecile, they're actually created a group at University of Calgary. It's called You Design Justice.
Okay.
And this is all about social housing, all about minor communities, all about the challenges, traumas, everything. and they are a very, really active group, and they're also part of our project.
Okay.
I think there will be a lot of discussion, and there is also a transdisciplinary scholarship that's happening at University of Calgary that can
Cool.
also be a really great pathway for this national work that you guys are doing. And I think Dash can collaborate with the QBE project where we can support your platform or invite
Yeah.
you to our conferences. The next one will be in Manitoba. We can definitely
Cool.
talk about it. I
Yeah,
know
I was going to say our emails are at the end of the
I'll
PowerPoint
put it in.
Yeah.
presentation. I'm wondering if
Yeah.
that might be the simplest way because I'm trying to click
Yeah.
the
And I'll
link.
also
I'm not.
put my email in case we lose each other.
It's good.
Yeah, that would be great. Please reach out to us because that's become a thing that we're really starting to chew on. So, anyways, thank you. Remy, I think I've read most of your comment. So one question I have, so yes, SHIP we've worked with, or not in this project, but I know SHIP certainly from other work. Coordinated access, yeah, is that HIFIS system. And in Ottawa, I would say it's sort of developed, but not at a strategic systems level. It's only the community agencies that the city funds, and that's like a tiny piece of the much broader set of service providers. Question, do you know the Pathways to Equity project at University of Saskatchewan?
Yeah, Katie. Hi.
Hi.
Um, yeah, we actually have a workshop because
Cool.
Pathways to Equity now works directly with QISA, where I work with Isabel.
Cool.
So
Cool.
we're planning a workshop where we're going to be discussing homelessness, with Lift experts being panelists at that event. Yeah.
So that's what my parents-in-law started basically
Oh,
and funded.
fantastic.
Yeah, they went to the university with like that as like, we want to see this. How do we do
Oh,
this? And
fantastic.
yeah, so that's really exciting. My father-in-law will be so excited if I say I was on a call and met somebody who was involved. Um, so yes, but yeah, I think that's the main response too is SHIP. Yeah, we have worked with SHIP in the past and know that they're kind of the key agency in Saskatoon. So, and have great, I remember meeting a few folks who are lovely. Yeah.
Just to clarify on the coordinated access list, if I can allow myself to add something, coordinated access is often with one population group, and I'm not sure if the one that you're alluding to has to do with mostly the shelter system, but it would be to use something like that, not necessarily to track the people and their needs and services, but match that with more data sets of people and housing need. So that would be like part of it. Yeah. But similar problems in terms of possibly privacy of data, yeah, confidentiality and all that too.
So we're going to have to start wrapping up here. I see there was one question in the chat just about the easiest and quickest way to apply for subsidized housing. I'm wondering, Katrine or Katie, if either of you just have a resource you can perhaps share in the chat to
Yeah.
support answering that question.
It's unfortunately city by city, so which is also unhelpful. If you're in BC, it's BC Housing would be the place to go, but otherwise it would be going to your municipal website, and then they should have how to apply for housing, which is not fast, to your point. And just speaking to your question around people with lived expertise, so they've been integrated. We have a staff team of people with lived expertise at the Alliance, and they've been informing the project from the start. So yeah. Yeah, totally agree. If we don't have that knowledge, we're not developing the right research.
Absolutely. And that's the spirit of community-based research. And again, the two of you spoke so eloquently about the strengths of those kind of collaborations, but also some of those challenges. So thank you so much to both of you. And we're just about out of time, so we'll just do a very quick wrap up here. Just to say, for those who might want to rewatch this recording at a later time or perhaps share it with others you know that were not able to be here today, you can do that. The recording will be posted on our website, and I'm just getting the link here. You can go to our website to view this recording as well as past recordings of other events as well. So you can find that there. Stay in touch with us if you're not already connected to CBR Canada. You can hear more about the events that we host that, similar today, promote community-based research. It's fantastic to see those connections being made here as well, some national collaborations being formed, because that's all within the spirit of what we do at CBR Canada as well. Lastly, the next series we have coming up, which actually starts next week, is a series called Centering Community and Community-Based Research, where we're really highlighting community-based research projects that um, have really embraced or centered lived experience approaches, projects that have been led by lived experience approaches when possible. And the first event in the series will be next week, centering lived experiences of incarceration in research, developing and implementing a prison health research council. So I encourage folks to come out to that one as well. I'm sure it'll be another very insightful and interesting presentation. So thank you, everyone, and thank you again, Katrine and Katie, for being here and presenting with us. Thanks for folks for joining. We hope to see you again next time.
Thanks for having us. Bye.
Bye, everyone.
And
Take care, everyone.
Nushin, I did put in the chat my email. She's probably off. Oh, yep, good. Please shoot me an email. I'd love to chat. Cool. Thanks.
And Amanda, our last slide was thank you to. See you.